Okay, good morning, everyone. Good afternoon. Those on the other side of the pond, this is John Skibiak, the Director of the Reproductive Health Supplies Coalition, and I'd like to welcome everyone to this webinar on the global contraceptive commodity gap analysis and the report, which was published and released just a few weeks ago at our executive committee meeting at the coalition headquarters in Brussels. I'm joined on this call by our panel, who includes Michelle Weinberger of Avenir Reproductive Health, and also Mindy Sibilia of CHAI, both of whom were key and central in putting together this analysis. There are also a couple other people, actually more than a couple other people, who I believe are joining here, who may chime in at some point during the discussion, who are also really central in putting this report together. That includes Nina Miller, who was really the principal writer and storyteller of this exercise. But also Maggie Murphy of JSI and Alexis Heaton as well of JSI, who were also really central in putting this together. The agenda that we have before us today tries to leave as much space open as possible for questions and comments at the beginning. We have now this sort of brief introduction that I'm hoping to get through relatively quickly. We then move on to the key findings of this costed gap analysis with an emphasis on the 69 FP 2020 focus countries. And I'd also like to shout out to FP 2020, which was also very pivotal in allowing this report to be undertaken, and also who provided their data on focus countries, the 2016 data that figured into the analyses. Many of you saw a preview of the results of this at our membership meeting in Seattle. This report that was published, and I think most of you have probably seen, it's now available on our website, is much more detailed than what was presented there. And it also looks much more closely at many of the implications that were discussed but not really pursued in Seattle, particularly with regards to the private sector and the implications for increased costs and the increased gap on out-of-pocket expenditures that we'll talk about a little bit later on. So the key findings of this cost and gap analysis will take up about 15 minutes of the presentation as a whole. And then we move on to another analysis that asks a different question for the gap analysis. And this is one that will be presented by Mindy, that again is looking at data but trying to answer a different question. And then hopefully we will end up with a fair amount of time for questions and comments. Really the context and purpose of this, the cost of gap analysis, does really offer new insights into consumption and future needs. Already in the lead up to the publication of the report, we've received many requests from partners to analyze the data, or to take their countries, or to take the particular contraceptive methods that groups are interested in, and apply the data we have to shed light on them, on demand for those products. So this analysis really does offer new insights into a very broad space. As I mentioned, excuse me, before, this really was very much a joint effort, and there were many coalition partners that came together, provided information, provided results that really ended up in this final report. There was a lot of knowledge sharing going back to early April of last year. We brought together representatives of really, across the reproductive health community to really look at what were key questions, what were key issues, what were different ways of approaching the data. This is also, as many of you will know, or at least those with sort of a historical memory on this, this is actually the third gap analysis that has been conducted under the auspices of the Reproductive Health Supplies Coalition or under the auspices of predecessors of the coalition. The first was in 2001 that was carried out in conjunction with the Istanbul meeting, Meeting the Challenge. Another was carried out in 2009. This particular gap analysis, I think, really also reflects the thinking of our community in the total market space. Unlike the 2001 and 2009, which looked exclusively at donor contributions to the gap analysis, and whose range of countries were limited to donor-dependent countries, for the first time in this analysis, we cast the net widely, and we look both at public and private sector, and we expand beyond the definition of countries that are just looking at donor-dependent to include both the 69 FP 2020 countries, but more broadly speaking, the 135 low and middle income countries as defined by the World Bank. So we really are applying the lessons and knowledge of the total market in this study. Finally, the advisory group that was established to really guide and provide a sort of, I don't know, moral compass is probably not the right word, but certainly a compass in moving us forward, were also very, very key to this. In terms of contributors to the analysis, as I said, we had the Track 20 project at Avenir Health, which provided the FP 2020 core indicator estimates for numbers of users and changes in the method mix. We had the Guttmacher Institute that provided data on commodity and supply prices from adding it up. The UN Population Division provided contraceptive prevalence trends and projections. We had Avenir, UNFPA, and NEEDY provide data on spending on contraceptive supplies, and both CHI and JSI provided analyses of procurement requests for 20 countries where they have special insight and knowledge of what's taking place within those countries. We also, as I mentioned earlier on, had an advisory group that sort of provided us with broad guidance in moving forward. That included Ian Askew from WHO, Eric Kink from NEEDY, John Bongart from Population Council, Wynne Brown from Gates Foundation, Jackie Derrick from Guttmacher Institute, and John Stover from Avenir Health. The stakeholder consultation, as I mentioned, was a very broad-based reaching out to our community to ask what were the questions that people hoped to get answered through this analysis. And in that process, we reached out to about 30 individuals from about 19 agencies and organizations, and these included donors, manufacturers, experts, and advocates. In terms of the methods that were covered in this analysis, we looked at 6 methods, plus another broader category that we called other, which combined methods that were really not in sufficient enough volumes for us to be able to really break them out. Emergency contraception, female condom, standard days method, LAM, and other barrier methods. And I know that's been a frustration to to many whose interest was in those methods, but that's really a function and part of the data that we were working with. Out of the discussions with the stakeholder group, we identified 4 driving questions that really shaped and guided the contents of this analysis. And I think one of the things that I certainly learned as a result of having been involved in this process is that the results really depend on the question you're asking. And I think for many of us who approach this, particularly looking back on the earlier analyses in 2001 and 2009, I think we kind of approach this really thinking, well, you know, commodity gap analysis is commodity gap analysis. Everybody knows what that's all about. And it was really only as a result of reaching out to the community and finding out what it was they were interested in that we came up with a series of questions. These 4 questions that you have here, but also a different question that helps to shape the results that we're now getting from CHI and JSI that's looking at procurement quantities and procurement costs. And so really it's not about right answers, wrong answers. It's really about what's the question that we're asking and how do the results that we get respond to those questions. In this analysis here, you see before you the 4 questions: how much is spent on contraceptive supplies, and what are the relative contributions of donor governments in low and middle income countries and individuals. How many women will use each method of contraception in 2020, and what volumes of supplies will they consume? How much do the supplies consumed by all users of contraception currently cost? And how much greater will the cost be in the year 2020? And what funding gaps can we anticipate in the year 2020? If donor and government funding does not increase, what burden will shift to out-of-pocket expenditures by individuals? And I think one of the things we will also be looking at towards the end of this conversation is how realistic is it to assume that, in fact, those out-of-pocket expenditures will compensate for losses or flat lines in government and donor funding should that take place. So this really is kind of an introduction to the overall presentation, and I'd like to turn the floor over to Michelle Weinberger, who will lead us on the key findings. Michelle?
Great, thanks, John. Go one more slide forward. So before we get into our answers to these 4 questions, we thought it would be useful to just set the stage a little to see what all we looked at as part of finding these answers. So as John already mentioned, in the full report, we sort of present 2 scopes. So the first is looking across the 135 low and middle income countries, and then a focus on a subset of the 69 FP 2020 focus countries. And in today's presentation, we're really going to zoom into the second group, but in the full report, all of the results are available for both of these. You'll see that we looked at quite a few different scenarios or angles of analysis, so looking at current spend on commodities, looking at 2 future trajectories, so if current trends continue out to 2020 versus if we saw acceleration towards meeting the FP 2020 goal. Throughout this presentation, as well as in the report, you'll see that these 2 scenarios are color-coded in green and orange, as you can see here. And then as well as this 20-country procurement analysis, which Mindy will be sharing with us later. And in terms of results, we can look at users by method. We can look at the quantity of commodities that these users will consume. We can value that consumption to get to costs, and then look at the additional spending that will be needed. Next. So just quickly, in the report, these results are presented at a high level for the group of 135 and 69 countries. But because this analysis was done built up from countries, there's the ability to look at other subsets, and we're actually working on a online tool that will allow people to have access to more of the detailed data that sits behind the report. So looking at individual countries for some results, or subsets of countries like the GFF countries. We also, I think John mentioned this a bit in his introduction, can look at specific results that are really of interest to different groups or different individuals who are participating within the coalition. So an example of this is maybe zooming in to really look at scenarios around growth of implants. So while the report kind of looks across these big sets of countries, there's a lot more that this data can allow people to do looking forward. Next. Next slide. Sorry, 1 second. Yep. Great. Okay. So our first question was to understand how much is currently being spent on contraceptives. To answer this question, we had to, at the time, go back to 2014, because that was the year for which we had complete and sufficient data to be able to look at spending across the full set of different people who are contributing. So as John mentioned, one of the things that we are excited about within this analysis is not only being able to quantify the spend coming from donors and governments, but also to look at that full pie of bringing in the piece spent by individuals and the private sector. So on the left, we see the breakdown of spend for the full 135 countries, and we see that there about 58% of spending came from individuals in the private sector, with the remaining 42% coming from the public sector, so split between donors and governments. And for the FP 2020, 69 focus countries, we see that the public sector share is a bit larger at 46%, with the majority of this coming from donors, and that the remaining bit, so still just over half, coming from individuals and the private sector. So in both sets of countries, see that private sector piece is already quite large and filling a big part of that spending pie. One thing to note is, for the purposes of this analysis, out-of-pocket expenditures in the private sector piece were valued at public sector prices, because we wanted a way to be able to have comparison across these two different types of spending. And so it may not reflect the actual spending that's happening in countries, depending on the actual pricing of commodities within the private sector. Next slide. So for our second question, we wanted to look where we are now and start to look to the future. First, looking at trends in total users. So as John mentioned, for the 69 FP 2020 countries, these trends follow the user numbers that were published in last year's progress report. So we saw that in 2016, there is just over 300 million women using modern contraception across these countries, and that if current trends continue, we expect this to rise to about 334 million by 2020 in our scenario A, and that if we saw further acceleration towards the FP 2020 goals, that this number would increase even more, up to about 390 million. Next. So this graph shows us how these users split method by method in 2016 and then changing out to 2020. So what we see with that light blue line at the top is that sterilization was the method used by the most number of women across these countries, followed next by injectables in that darker blue. And injectables were also the method that saw the largest increase. As you can see there is an increase of over 17 million women using injectables between 2016 and 2020. We also saw male condoms in the green and implants in that light orange color increasing a fair amount as well, of more than 8 million and nearly 6 million respectively for these two methods. So these changes in method mix are informed by what's happening country by country. And so we use data for each country of their current method mix for both married and unmarried women separately, coming from surveys. And we built in regional shifts in change, so seeing patterns that we're seeing now around the world of how method mix is shifting and applying those patterns out to 2020. Next. So our next question of interest is to understand how that use and how those shifts in method mix will turn into commodities that are needed to supply those women, and ultimately what it'll cost for those commodities. And so what we see here is our estimate that in 2016 that it costs just under $900 million to supply all of the users across the 69 focus countries. And you can see from the two boxes how this will change going forward. So raising to just over $1 billion under scenario A if current trends continue, and to nearly $1.3 billion under scenario B, which is acceleration towards the FP 2020 goal. And so these changes are driven by two things. They're driven by the change in the overall number of women using contraception, as well as shifts in what methods they're using and the relative cost of different methods being used within that method mix. Next. So now we can start to put these different pieces together. So to understand what gaps might be, we first look at how much we think will need to be spent for this consumption each year. So we're showing results here for 2020, but these have been calculated for each year from 2016 up to 2020. We can then compare that to our estimate of spending in 2014, so this $820 million that was spent on contraceptives in order to start to calculate a gap. So in examining the future funding needs, we decided to keep this 2014 spending baseline static rather than growing it over time. We knew that this was conservative because we know that generally spending on contraceptives has increased over time. However, given the outcome of the U.S. election and given the current situation around funding and potential shifts to funding, we see that an approach that at the time might have seemed conservative might now actually be a more realistic or perhaps even an optimistic picture of what future funding and future gaps might mean going forward. So we see here with the final two boxes that if we compare the total amount needed for commodities in 2020 to this level of spending in 2014, we see a gap of $233 million in 2020 under scenario A. I want to note that this gap is the annual funding gap in 2020. So there would also be a funding gap in each of the years leading up to 2020. So meaning that the cumulative gap over the next few years is much larger than this figure. And as you can see at the bottom in the orange box, that under our scenario B, that acceleration scenario, that the gap would be even larger because you would be needing to meet the needs of an even larger number of women using contraception. Next. So in the report, we look at these funding gaps in two different ways. So first, we look at what would happen if each person, or each group contributing to the spend, so the public sector and the private sector, kept up the same share. So the pie is growing, but if we kept everyone having a similar slice of the pie, how much more money would each group need to contribute? So at the beginning, we saw that the public sector made up 46% of the total spend. So what would happen if that 46% was kept, but the pie got bigger? So clearly it would be more money. We also looked at a different case, and again, perhaps one that is more realistic given the current circumstance, which is what happens if that public sector funding just stays static at 2014 levels. So we saw in 2014 that the public sector contributed just about $375 million towards contraceptives. So if that stayed static, but the pie grew, then it means the share being contributed by the public sector is shrinking. So as you can see in the two pie charts here, in scenario A, that would shrink from 46% to 36%. And in scenario B, since the funding need is even greater, it would shrink further to just 30%. So I think what's most important to note in both of these is that purple bit of the chart, that individual and private sector spending is increasing, both proportionately and in absolute terms. So what it means is that if that public sector contribution is held static at the 2014 level, or if it even flipped down below it, that we're offsetting those declines or those drops by increasing the burden on individuals and on the private sector. So we see that here proportionately. And then on the next slide, we look what that means in absolute terms as well. So, so we saw already that the proportional share for the private sector and individuals would increase. And we see here what that might mean in terms of actual dollars. And so we saw earlier that we had this $233 million funding gap in the year 2020 alone. So in the case that the public sector spending stayed static, that entire funding gap would be shifted to individuals. So within that $233 million, we have $127 million more that would need to be spent just to keep that individual share the same. And then we'd have an additional $106 million that would have to be spent to sort of offset the declining share from the public sector. So because their percentage is slipping back from 46 to 36, that extra bit would also then shift over to individuals. And as you can see in scenario B, where acceleration towards the FP 2020 goals happen, that additional burden would be even greater, so nearly doubling the amount that individuals would spend.
Thank you, Michelle. We now turn to Mindy, who will look at procurement funding and really present the answers to a different question. Mindy.
Thanks, John. So the procurement analysis, and you can go to the next slide. The procurement analysis addresses a different question on how much funding will be needed for public sector procurement for the FP 2020 countries that were included as part of this analysis. And the main focus of the analysis is on the quantities that need to be procured to meet end user needs, which includes both anticipated consumption and what's required to maintain adequate stock levels throughout the supply chain. The analysis that Michelle just walked us through shows the cost in terms of the quantities of the products anticipated to be consumed and the funding required to meet this anticipated consumption. But before a product can actually be consumed by the user at the service delivery point, it must be stocked at all levels of the country supply chain. Therefore, countries aren't just procuring the quantity that's anticipated to be consumed. And this typically means that countries have to procure up to a year or more out before the product actually arrives at the service delivery point. And so each year, and this process varies by country, but each year country stakeholders determine the quantities of each product that they need to procure by developing a supply plan during a quantification exercise. And the quantification takes into account estimates of future consumption, existing stock on hand, inventory control parameters, existing orders and shipments that are en route, supplier lead times, and the results represent the country's own assessment of what they will need to procure based on agreed upon rates of growth and scale up and provision of family planning. These country-led supply plans are generally based on realistic scenarios rather than aspirational targets and cover 2 to 3 year cycles that align with the country and donor funding cycles. The quantification results drive what donors and government actually procure, how many contraceptives they procure. And this level of detailed data is not readily available across a wide range of countries and did not make sense to take into context for the full market analysis for the 69 or the 135 countries. And so the procurement analysis includes countries for which this detailed data was available, which in this first iteration includes just 20 countries, which was conducted to estimate the funding gap related to the cost of products to be procured for 2016 to 2020 for the public sector only. And so in order to come up with this figure, we took these country forecasts and supply plans, the country-specific supply chain parameters, and carried this forward to 2020 in instances where the country supply plan didn't go all the way to 2020. And details of the methodology and the process for doing this are in the full report and won't take time now to go through that. And so we aggregated the country results to come up with an overall estimate of the volumes and the cost of commodities required by method and by year through 2020, and compared the projected cost to historical spending in the public sector for the same 20 countries. Go to the next slide. The analysis projects that in the year 2020, the 20 countries will require a total of $337 million for the public sector procurement of contraceptive commodities. This is an increase of $127 million over the $210 million required in 2016. And you'll notice a slight dip in 2019, and this is due to the timing of the shipments and where they fell in the country supply plans. The total public sector spending on contraceptive commodities in these 20 countries in the year 2014 amounted to $166 million. This amount includes spending by international donors and NGOs, includes World Bank loans and basket funds, as well as government spending from domestic budgets using internally generated revenue. And if the public sector spending were to freeze at the 2014 level, the resulting funding gap for the 20 countries would be $45 million in 2016. And if spending continues to remain stagnant through 2020, the funding gap for the 20 countries would increase to $171 million. The estimated total gap across the 5-year period is $560 million for the 20 countries. And of the 20 countries, 97% of the historical funding is from donors, and only a small percentage is government funded. And since these countries that were included in the analysis are primarily dependent on donor funds for commodities, any dips or changes in donor support have a significant impact on commodity availability in those countries. And even though this analysis just captures 20 countries, these countries actually compose 63% of the institutional procurement value from 2011 to 2015 of the 69 FP 2020 countries, and is a good representation of a larger issue of insufficient global funding for contraceptive procurement.
Great. Thank you. Thank you very much, Mindy. So I guess now we move, before we open the floor to questions, looking ahead 2017 and beyond. As Michelle mentioned earlier in her presentation, there are two sets of activities, immediate activities, that draw on the results of this analysis. One is an online tool that is being developed that will soon be on the Coalition website, that will allow users to be able to select groups of countries to look at the gap analysis in those countries. So it'll be a tool where you can really filter the countries in which users are interested to come up with a more tailored approach to calculating the gap. We are also, we have been developing a series of briefings and fact sheets for subsets of countries and regions. We've done that for the GFF plus countries, the 15 countries. We did an analysis of the UNFPA countries. As many of you know, UNFPA has been for some time talking about the gap they confront in resources to meet the needs of countries, their priority countries. we use the findings from this analysis to perform a parallel analysis and found out that in fact our results almost compared identically with the findings of UNFPA. And so there's several other clusters of countries that we are applying this analysis to, and we certainly welcome other groups who are interested in pursuing that to let us know, and we can perform the analysis. The costed gap analysis will be updated annually. This is something that we've put in our work plan for the years moving ahead. We will refresh the data on contraceptive use, and each year moving forward we will have better data. We will be able to compare in 2017 the baseline not against the 2014, which we use this year, but rather to the 2015 data that will also be available. But we also, looking ahead to 2017, and I'm hoping we will get other suggestions from this call as well, want to focus on particular areas where we feel there is room for improvement. We want to have a better sense and a better grasp on prices in public sector. As Michelle mentioned, the prices that we use were the same prices that are available through the public sector. I think in reality that is probably a very conservative estimate. I'm sure that in much of the private sector, individuals are actually paying considerably more than what is available through public sector procurement. So we certainly want to move forward in understanding that. But we also want to explore in greater detail the impact of these scenarios that we've been discussing on individual spending. As Michelle pointed out, one of the concerns that I think has been expressed is that we flatlined expenditures, 2014 expenditures, moving forward as the baseline for looking at the gap. That has lots of implications for individual spending, and we want to really take a more nuanced look at how realistic those scenarios are, and whether or not we may very well, as a result of flatline spending and potentially even a decrease in spending, we may start seeing not just a shifting of sections of the pie, but we may actually see the pie itself shrinking, which was a scenario that we didn't analyze in this analysis here. So we will be reaching out to partners as we did last year to be getting questions that we want to guide the analysis in 2017. Many of you will be receiving correspondence from us and input into the shape of the next commodity gap analysis. We have exactly 20 minutes left on this call for questions, which is what we were hoping to get. And I'd like to open the floor to questions. Yes.
So if participants can use the chat or the questions box, that's going to be the easiest way. You also have the option to raise your hand if you can see how to do that, and we can try to unmute you, but that is not always a guarantee. So I see we already have some questions coming in with the question box, so that's where we'll get started.
Okay. What I will do is I will read the questions as they are coming in. And the first question from Helen Patach was, how was the percentage of spend from individuals and private sector value obtained? And Michelle, if you want to respond to that.
Yeah, so we used data from DHS surveys on the source of contraceptive methods by each method and made some estimates to try to account for, we know there's a bit of overlap, so not all commodities bought within the private sector are fully paid for by individuals, so we know that there's some crossover of those donor and government-supported commodities, so accounting for those gaps to be able to estimate the share of expenditure that happened within the private sector and out-of-pocket spending by individuals. And as mentioned, and John reiterated, that right now those are being valued, so that volume of commodities being purchased in the private sector are being valued at a public sector price, but that is something that we're looking at more for the 2017 report.
Great, thank you very much.
I saw that John Townsend, you raised your hand, so assuming that was intentional, I just tried to unmute you. So John, if you want to try and talk.
Sure, thank you. I was just writing out the chat, but I could ask the question now. I mean, this is a really interesting analysis and thinking about what are the consequences of a persistent gap over time. I mean, you might say that that people will use out-of-pocket expenses more increasingly, as they did in Indonesia during the banking crisis. Sometime 15 years ago. You could say that women will not spend money if they have it on contraceptives, but would take the risk on seeking abortion care. They have that choice between how they spend their money. It may be that private sector workplace programs would increase as with increasing number of women in the workforce in critical positions. That employers who want to keep women in the workforce would increase insurance support for workers. It'd be helpful to have some of those scenarios at least on the table as we discuss the shortfalls and the potential implications for the future. Every time we've seen an increase in access and use of contraception, we've seen a drop in abortion, an increase of women's participation in other civil society venues. It'd be important, I think, to just lay out some of these things that might happen if governments do not make the decision to increase domestic resource mobilization or international support. Thank you.
Great, thank you. And I think your points are well taken, and we will certainly look at those as we're looking at the scope for the cost and commodity gap analysis for 2017. We just have another question in here, and this is from Chandramani Dungans. I'm sorry if I mispronounced your name. And the question is, I'm from Nepal and one of 69 FP 2020 focus countries. Do we have country-specific commodity gap analysis? If yes, where can we find it? If not, can you please help us do such an analysis? I think I will actually hand that question both to Michelle, but also to Mindy. I know, Mindy, you're not publishing the individual analyses. I don't know if Nepal, I can't recall whether Nepal was one of the 20 countries in your list. But Michelle, maybe if you want to start, and then Mindy, you can add on to that.
Yeah, so through this online tool that John mentioned, part of the equation is going to be available for countries, which is looking at our projections of user numbers, those users broken down by method, and then breaking that down into the commodities they will consume and the cost of those commodities. We will not be doing a full gap analysis country by country because having complete information about what is spent in each country on a country-specific level is a bit difficult, and we know that there's lots of additional information available within the countries, and so we don't want to put out numbers that don't sort of take that full rigor into account. And so the trends will be available, and then those can be compared to other information on country-level spend that is ongoing through other efforts.
And just to add to that, so Nepal was not included as part of the 20-country analysis. because we didn't have a supply plan or quantification or the right data from Nepal. But I would say that, you know, if there is data and if you share it, we would be happy to look at what the gaps are for Nepal. I know the Coordinated Supply Planning Group, that's part of RHSC, does country-specific funding gaps for a shorter time period, so looking at just those funding gaps for 2017 and in some cases 2018. And these are country-specific. The data is available and it's shared with donors to try to address some of those urgent gaps. So I don't know if that answers your question or not, but I'd be happy to follow up with you offline if you have data for Nepal, because that is a country that, you know, we would love to include, but we haven't had access to good data there.
Great, thank you, Mindy. And yes, please, if you do have that information, please forward it, and we can certainly get it to Mindy. The next question I see on the list here is one from Jane Wickstrom, and she's saying that while not a commodity, sterilizations are a major part of the family planning method mix. How are we going to capture the cost of sterilization in the future? The overall family planning funding required is now an underestimate without taking sterilization services into account. The medical equipment, instruments, and supplies are commodity costs and can be estimated even if we don't add labor costs to the family planning estimates. Again, Michelle, I think maybe you can provide a bit of introduction into how sterilization was calculated in this analysis.
Yeah, so one thing I would say is that this analysis is very much focused on the commodities, but in recognition of this point, we have also included the cost of sterilization kits within the analysis. So part of those costs are being picked up here, but recognizing that for sterilization as well as for other methods that require a clinical service, we're only looking at part of the picture. We're only looking at the cost of those commodities and those supplies without picking up the cost of the service delivery itself. So I think those are important, but a little bit outside the scope of what we are looking at within this analysis.
Great, thank you very much. We also have another hand raised from Angela Matunga. Angela, do you want to deliver your question in person?
Yes. So thank you, John, for leading this presentation and for great presenters there, and Ongera for the good work done. I happen to be a CSO rep on the GFF, and I'm so delighted to know that the 16 countries that are participating are part of those countries that great analysis has been done. And so, John, the question is to you. What are the intentional plans to reach out to the decision makers of these 16 countries with the briefings, with the briefs and the fact sheets that we've produced, you know, towards making connections and speaking to them in a manner that we can get results for the questions that we have, particularly on drawing increased financial allocations towards this subject matter at the local level?
Yeah, good question. The analysis we did was not for countries individually, but rather was for the 15 countries taken as a group, and we presented that in DAR. Actually, Tim Evans was there when we gave a similar kind of presentation to the FP 2020 reference group, and we had the fact sheet that we presented to the group as a whole. I mean, I think this is an opportunity now, particularly that we have this full report, to share that fact sheet and to work with the GFF to really highlight the potential need and yeah, the need for greater domestic mobilization of domestic resources to cover, what will clearly be a gap, because it is quite significant. So I think working together with decision makers within the GFF is really something we intend to do moving forward. They are here in Washington, D.C., so we have an opportunity to work with them and meet with them. There is another, I have two other questions. One is from Jim Rosen, and he is asking, and again, maybe Michelle, what sort of sensitivity analysis did you do, especially around prices? Did you estimate a low and a high range for your estimates?
Yeah, so for this analysis, we have used a single price for each country based on work done by our colleagues at Guttmacher for the Adding It Up report. So those prices take into account different types of commodities being purchased in each country and different price mixes, so some mix of what is being spent. But we didn't do any ranges or sensitivity analysis. We've just used that single set of prices across all the methods within each country. But something we do hope to do for the 2017 report as we explore more of this question about that true cost of out-of-pocket is to bring in additional information, and that's where we know we're going to have to do some more sensitivity testing, because there's a fair amount of variability in those costs that are happening out-of-pocket and in the private sector. So it's something to look to for the next iteration of the report.
Great. Thank you. Thank you. There's another comment here, and it's a question, but I think it's also one that probably will sort of inform where we go perhaps in the next iteration of this analysis. And it comes from Jason Bremner at FP 2020. And he's asking, do we have, and this is a question I think probably both Mindy and Michelle can feed into, do we have a basic estimate of what proportion the contraceptive commodities are of the overall spending on contraceptive services? And he throws out a scenario that it seems like one of the likely scenarios will be the donors fund commodities first, with their possibly shrinking resources at the expense of other aspects of services. I know this is one of the areas where there are differences in the two methodologies. Maybe, since Michelle, I'm calling on you first all the time, maybe Mindy, do you want to say something about the relationship between the two costs?
Sure. Yeah, so for this analysis, we just looked at the spend on contraceptives and not the spend on contraceptives as part of a share of the total amount spent on contraceptive services. I think it's an important point and distinction. And I think what we've, I think the challenge with this is that as you spend more on, service delivery, on training, on improving the supply chain, on data visibility, on investments into data systems, on demand generation, as more money is spent on these the other aspects of what it takes to provide quality contraceptive services, if we see the funding for commodities flatlining, it makes it difficult to realize the investments that we're seeing into service delivery. And so I think the relationship is important and it's related. The more you invest in the service delivery side, but if you don't, follow that with making sure that there's enough commodities to actually realize the growth that's being, and funding that's being put into training and into tracking data, then that's also problematic. So I think it goes both ways, and perhaps that's something that can be taken into considerations in future iterations of this project, but it was not something that was looked at but I do think it's relevant.
Thank you. Michelle, did you want to add to that?
Yeah, and again, for the purposes of this analysis, we are really focused on that commodity piece, but I think this is, again, where working across the partnership that RHSC brings together is that a lot of the work done by Guttmacher on the Adding It Up report is sort of looking at that bigger picture of not just commodities and supplies, but then also salaries and program and system costs. And I believe from their estimates that piece on commodities is usually somewhere between about a quarter and a third of the full cost when looking at salaries and program and system costs. So definitely substantial, but also a good reminder that it is not the whole pie, and there's quite a lot of other funding needed to ensure that those commodities are making it out to women and that they have access to high quality services.
Okay, great. Thanks so much, Michelle. And I think we're really, yeah, I can see we're really calling it close here. We've got a minute or two left. There are a few questions that we have here, but I think one, maybe a quick question that's sort of easy to answer, and maybe Michelle, you can answer this one. In the analysis, the question is, does the analysis look at the cost of expendables that are required to provide these methods? Can you comment on that?
Yeah, so we used, again, the unit costs coming from what the Guttmacher had put together for their Adding It Up methodology, which included both the commodity itself as well as other supplies needed to deliver the contraceptive commodity. So those are included in our estimates.
Great. And Mindy, in your analysis, are those costs also included in your analysis?
No, these costs were not included as part of the analysis, since most countries, when they're doing their procurement plans at the national level, they don't include consumables and equipment. That typically comes from other resources, which is a whole nother challenge, but it was not included as part of the analysis because it's not included in the country national quantification reports.
Right. Okay, great. Well, unfortunately, we still have lots and lots of questions that have come in, and I can assure you, we'll be getting back to you. Some of these are really interesting questions asking about, how can we apply this methodology in the area of maternal health supplies, for example. How can we use these findings to promote and support advocacy efforts? A lot of really, really good questions here, and unfortunately, we just don't have time to answer them. I'd like to thank really everyone who was involved in the preparation of this report. I won't go through the list again of all the people who did play a role, but we at the coalition here are really grateful for all the input that we've received from members, both in casting the broad framework within which this report was done, but also providing the data and the analysis and the brain power that allowed us to deliver this report. So thank you, Michelle, thank you, Mindy, thank you, everyone who joined the call, and we look forward to answering and responding to the questions we weren't able to answer. So thanks very much.
Thanks, everyone.